Hi everybody, this is Dr. Marc Adajar from XSculpt, and this video today is to teach you on how to take care of the drain that was placed after your surgery. Okay, now it's very important that you had this drain placed, and the reason why is because what it does basically is it removes the buildup of fluid from the surgical area after the surgery. If this fluid builds up to an extent at the surgical area, it could ruin all the hard work that was done for your surgery, and we don't want to do that. Or the fluid can what we call loculate or stay in place, and we would have to aspirate it in the office several times. And aspiration basically means that we would poke the fluid collection with the needle. Sometimes you have to do it once, sometimes you have to do it several times until the seroma doesn't, or the fluid collection, which we call seroma, doesn't form anymore. But the use of the drains can greatly diminish that. The drain also helps, collect any excess blood that occurs after surgery, and so it doesn't stay in the surgical area, and the chances of infection diminish. So it's very important that these drains are well taken care of and used properly during the postoperative period to prevent any type of complications that occur, and so that they do their job. Okay, so basically what you'll notice is that depending upon where you had your surgery, if you had surgery done on your chest, it may be coming out of your armpit, or maybe coming out of the side here. If you had surgery in your abdomen, it may be coming out of one of the incisions in your groin here. If you had a tummy tuck, very similar, it may be coming down out from here. Sometimes those are usually the places where they come out. Now, this is the bulb of the drain, and this is the tubing. Now, the end of the tube is a part that goes inside your body. There are different types of ends. This is what we call a Blake drain, but the most common is what we call a JP, where instead of this, it's a flat white portion with a lot of holes in it. Okay. Regardless, what's important for you to know is that the bulb part and this part. Okay. And so what you'll notice is that usually at the exit of the skin, either here in the groin area, the drain is sutured to the skin, and that's very important that there's no tugging on that area, because it maintains the drain in its appropriate place inside the body. So the drainage holes are where they're supposed to be. If this gets tugged and the stitches break, the whole thing can come out prematurely, and either we would have to do the aspiration of the fluid collections, or seromas, like I said, or put the drain back in, which definitely you don't want. Okay. However, so it's important to take care of the exit site. Okay. Now, regarding the bulb. Now, what you'll notice is that there's this tab, I guess, that goes in here like that, and it prevents leakage. Because what you'll notice is that the fluid, this will be on suction. When you see it, it'll probably look something like that, right? And so what happens is that when you squeeze it, this generates a suction, and all the fluid comes from inside the body down this tube into the bulb, and it collects in the bulb. And then gradually what will happen is that as it fills up, that's what's going to happen, is it generally fills up with fluid. And often you can see here that there's markings on the bulb itself to tell you how much fluid was collected. Okay, so it's important that at least at least once a day, possibly twice, depending upon how much liquid comes out, that you would empty this. You record the output for your surgeon, for me or your surgeon, because we use that as a determination on when we can take it out. So, not to empty it, basically, it would probably look something like this, except that it's full of fluid. There'll be fluid somewhere in there. Okay, it may be halfway squeezed, or maybe fully expanded like this, but regardless, once a day you would change it. So basically what you do is that you note at what mark or how much milliliters or how many cc's is in this bulb when it's fully expanded, okay, like that. And then you write it down, okay? You make sure you write it down for every 24 hours, a total for 24 hours, okay? And then basically you pop the tube and then you squeeze it out like this into the sink or the garbage, okay? But now, after you do that, okay, it's important that you squeeze it like really tight, like that, really, and all the fluid is out and all the air is out as much as possible. And as you're squeezing it, you take your hand, the cap, I'm sorry, and then you put the cap back and it's nice and secure. And if you do it correctly, what you'll notice is that it'll stay like that, okay? And it maintains suction. And then what happens is that when it fills with fluid again, it will slowly expand like that. And you know, because it don't have fluid, it's air, but it'll fill with fluid. Then what you do is you pop this open, you go to the sink, or you pop it open, you record how much fluid is in there, you go to the sink, you empty it like that, you put the cap on like that, and then you let it go and it should be like that, okay? So that's basically how you empty the drain and record the numbers. Usually when you shower, you know, one of the most common questions is, can you shower with the drains? Yes, you can shower with it. However, ideally, you'd like to avoid as much as possible getting the drain in the entry site that goes into the skin. You'd like not to get that area wet if possible, because, you know, we'd like to, as much as possible, you don't want bacteria to go inside the body. So you'd like to maintain the dressing that's on top of it, since it was placed on during during the surgery, which everything was sterile. So as much as possible, you'd like not to get that area wet. And so you know, once the drains come out in the office, then you can shower those areas. You just keep those areas very well covered while you're in the shower. It wouldn't be a bad idea to, you know, keep those, you know, you can clean the area of the drain site where it really comes out of skin with some alcohol. It might sting a little bit, but it's, like I said, it's important to prevent any bacteria. By the way, one thing that's important to do is what we call milking the drain, okay? Now, what milking the drain is that sometimes, you know, like I said, the fluid will go through this tubing and into the bulb, right? Now, sometimes the blood can clot within this tube and clog it, okay? And if that happens, the bulb will not fill out because it's clogged. This tubing is clogged. So it's also important that you what we call milk your drain occasionally to get the blood or the clotted blood or any sediment inside the tube out. Okay, so what you can do is you can take, you can wash your hands with some soap and water with a little bit of soap on your fingers. You could basically pinch the tubing like this, okay? And basically what you do is you pinch and stretch the tube like that, okay? And so you're pinching and stretching the tube all the way down to the bulb, okay? So you would start, as much as possible, you start as close to the skin as possible, okay? If you're, let's say, pretend your skin is coming out of, let's pretend it's coming out of here. You would try to pinch it close to the skin as possible, you know, without obviously pulling out the drain. You would pinch it, wet your hands a bit, and then just basically stretch the tube, you know, stretch it. And what will happen in combination with the suction in the drain, it will empty out any blood clots that's in the tube, okay? An alternative way is what you'll sometimes see docs do is they'll take an alcohol pad like this, they'll go like this, and they'll slide it like that, okay? They'll slide the tube like that, and so we're stretching it, making it flat, which is allowing us to unclog the tube, and all the blood clot will go into the bulb. So it's important to milk the drain once in a while, like once a day, to make sure no clot is in there. If you ever see a clot in it, then milk the drain out, absolutely. But to maintain the drain, maintain the suction, you know, after you empty out and put it back on suction, you'll milk the drain to make sure it stays nice and clog free. I think I covered pretty much all other things you need to know about how to take care of your drain after surgery. If you have any questions, particularly for my patients, please email or text me right away. If you're not one of our patients, you can leave a comment you may leave a comment below, and either myself or one of the other doctors can get back to you. A very important video for our post-operative patients who have drains. So take care, and I hope to see you soon. Bye.